So Paul Arnold is a child and adolescent psychiatrist who came to Calgary from the Hospital for Sick Children in Toronto, and he's now director of the Mathison Centre, and he's here to set the scene for the panelists. Paul.
Before shifting to our panel, I'd like to just provide also a few brief highlights about the topic of tonight and some biological perspectives, my own area of research and interest. My own research interest is in genetics on adverse childhood experiences. I think we've long known that psychiatry and mental health does have a connection with early childhood adverse experiences. Both physical and mental health can be impacted by these experiences. Adverse childhood experience is a term you'll hear thrown around a lot. Sometimes you'll hear the term ACEs for short. It does include a range of things, and one of the most popular ways of measuring it is essentially a cumulative score of different experiences that occurred during childhood. These include a wide variety of experiences ranging all the way from maltreatment, so physical, sexual, emotional abuse and neglect, for example, to other kinds of early adverse experiences, such as the impact of having a parent with a severe mental illness in the home. So I think first of all, it's important to note that the cause of mental health disorders, they're multifactorial. It's complex. So there's a tendency for all of us to kind of seek, I talked about complex problems requiring complex interdisciplinary approaches, but to seek simple solutions, and we start to hear about this research, we think, that's the answer, and we swing the pendulum from one cause to another. But it's certainly more complicated than that. So there's other factors, so for example, the role of hereditary genetic factors that can play a very important role. Secondly, the evidence suggests that it's really severe adverse events or the accumulation of multiple adverse events that confers risk for mental health disorders. Again, not to interpret things. So stress is an important part of life, and childhood is stressful. So simply having a bad day or having a less than perfect parent is not a cause for grave concern that the individual is going to be at risk for later mental health disorder. It's the accumulation of multiple events combined with other factors, or sometimes the severity of events that occurs. So it's important to keep a perspective on this. Finally, and I think perhaps most importantly, that ACEs or adverse childhood experiences are not deterministic. There are lots of individuals who are resilient to even severe ACEs and have very happy and healthy adulthood.
There's lots of people in here today in our community that are pulling on the rope, doing great work, and I think that's what it has to be, right? We have to look at these issues as a community issue. How are we working together? What are we doing to work together? I think when we look at the issues that we're talking about with Paul today, and when we look at the research that we're looking at, it's not a childhood issue and it's not an adult issue. It's from A to Z issue. And we need to connect the dots. And we've never ever connected the dots. We never ever connected the dots from childhood issues to adult issues. It's always adult issues or child issues, one of the two. And we need to connect the dots. And to me, that's an important piece. We knew that dealing with child abuse, the best way that we could do this is if we're working together. We have to work together. And if we looked at the way we were doing it before, there was no collaboration at all. The police didn't talk to social workers, who didn't talk to healthcare, nobody talked. Right? The family had to go here, had to go there, had to go here. It'd be like having an x-ray of a broken leg and cutting it into 4 slivers, giving one to police, one to child and family, one to health, and say, well, fix the broken leg, but you can't talk to each other and you can't show each other the x-ray. Right? So if we look at the Sheldon Kennedy Child Advocacy Centre, if people think it's a miracle or something, but the reality is what we've done is we've taken the agencies that have had the legislative mandate and brought them together and taught them how to work together. And I think the biggest thing is that, when we hear the word multidisciplinary, co-location, we throw those words out all the time, and I think the reality is it's really about integrated practice. At our center, we got great buy-in. We have memorandums of understanding from the Calgary Police to Alberta Health Services, Alberta Children's Hospital, Child and Family Services, the RCMP, the Crown Prosecutor's Office, Satina Nation, Calgary Catholic, Alberta Board of Education, and our Calgary Board of Education. And to us, it was about taking the services that already existed, bring them together, and work together in the best interest of the child and family. The average age of the kids, the highest percentage of kids that come through our door are under 12. But the reality is what is the presenting issues that these kids present when they walk through our doors? Well, 62% of them present 3 or more of suicidal ideation, self-harm, addiction, mental health issues, depression. I mean, the list goes on. So when we look at the cost of this, child abuse alone in our country is $21.4 billion. In this province alone, it's $2.4 billion. And that's just child abuse here, let alone all of this. So I think what we're trying to do is we're trying to build a confidence, and we're trying to create a strong business model with strong evidence to have systemic shift. We have to change the way we do this work. We have to understand that when a child comes in before the age of 12, we have to do the best we can do here so that we don't see them down here. And that's what we're trying to do. We're trying to have systemic shift.
I was in DC in 2012 working on a US Supreme Court case involving the question of restitution for victims of child pornography. And what those victims told us is that the nature of child sex abuse in the 21st century is changing. That it used to be that a child was abused and had a horrific experience, and they disclosed this abuse to someone, or someone discovered it, and the abuse ended. And then they would receive treatment, the case would go to court, there'd be some restitution, and they eventually would start to try and move on with their lives. But in the 21st century, where all of us record everything that we do all day long, we take pictures of our food, we take selfies of ourselves wherever we go, we check in online, and what ends up happening is that we see people who historically wouldn't be producing child pornography, who are now taking pictures of their sex abuse of children. At the same time that we're seeing more and more people taking pictures of their abuse of children, we also are seeing an increase abuse of children, which I suspect is due to all of the online pornography, which is developing addictions so that people need more and more extreme pornography and different imagery in order to get the same high that they got from what they had viewed just a few months before. And it's taking people who historically wouldn't probably have been pedophiles now into the realm of needing to produce child sex abuse after consuming it in order to get access to more and more imagery, which is how the dark web works. So what ends up happening is that the victims describe an experience of experienced sexual abuse, it being recorded, and then trying to move on with their lives and being unable to, because literally someone will come up to them in the restaurant where they work and say, "Where do I know you from?" Or sit down next to them in college and say, "You look so familiar. Don't we know each other from somewhere?" The victims have reported people coming to their front door and knocking on their door and saying, "I saw the pleasure that your uncle gave you. I want to give you that pleasure." And suddenly, they know that their abuse will never end, that it will last for the rest of their lives, because right now it's virtually impossible to capture all of those images and to prevent them from continuing to be trafficked. And so the victims are describing that not only do they know that their sexual abuse is continuing through the trafficking in their abuse imagery, but they also say that they now have discovered that it's not just their stepdad that they realize they can't trust, or their aunt who trafficked them, or their uncle who abused them, but rather they're starting to find out who is trafficking in their images, and they find out that it is professors and lawyers and doctors and teachers and clergy. So then the question is, what does this do to them? We hired an economics expert in that case, Paroline versus US, to determine what the damage was to a survivor of child pornography. Anyone want to guess what the amount of damages is?
Until the bell goes?
3.4 million. That's right, $3.4 million across the victim's lifetime. And so then the question is, where does that money come from? Well, as a lawyer, as an international children's rights scholar and advocate, I immediately look to international law. And I say, okay, under international law, these victims are entitled to full recovery, physical and psychological, and they're also entitled to full social reintegration. In addition to that, the international law provides that every country must provide a legal system that allows the victim to recover those damages from the perpetrator. So then I start looking at the laws, the systems in the US and in Canada, and I start to find gaps. And guess what? We're two of the largest sending and receiving countries in the world when it comes to child pornography. We have a problem. We are addicted to these images, and we're victimizing children when we perpetuate that addiction. So basically what happened when I looked at the two systems, I found out that there is a gap in our knowledge, and that the only way that we can fill this gap is to have academic organizations partner with therapeutic centers where we can conduct research in order to document how these kids are being harmed, because many people assume that kids can get over child sex abuse, and they assume that child pornography, the trafficking in their images, isn't really hurting them because they don't know, but they do know.
Just taking off from what everyone's said here today and also what Paul mentioned, one thing to think about is that we all experience adversity in some form or another. So it's actually quite healthy for kids to experience adversity. It teaches them how to be able to, when they have struggles with peers, how do they overcome that? How do they move beyond that? So these mild forms of adversity are actually things we want kids to go through. But when we're talking about ACEs, we're actually talking about severe forms of adversity, these more prolonged forms of adversity, such as physical, sexual, and emotional abuse. And what makes these types of experiences particularly toxic is that they often occur without adequate support, or not in the context of a supportive relationship. So if you think about physical abuse, for example, 1 in 4 children in Canada experience physical abuse. And oftentimes that's by a caregiver. So the person that they need in the time of distress to resolve these very difficult traumatic experiences is actually the perpetrator of that abuse. And that is incredibly devastating for a child. So as Paul mentioned, though, ACEs aren't deterministic. And this means that there are many individuals who experience adversity but are able to overcome it, or who don't suffer the same hardships later on in life. So we call these individuals resilient. And the work that I do here at U of C, and together with many other colleagues in the Mathison Centre and in various departments at the university, is to try and understand what fosters adaptive success, what makes individuals resilient in the face of adversity. It's really important to understand that, because then we can try to foster that in other ways, and we can try and help people who might have experienced these events. So in particular, my area of research is to study adversities that happened in childhood and how that might carry forward to the next generation. So children can really be buffered from the impact of these traumatic experiences if at least one of these parents can help them be a safety net, a social support for them when they're having significant distress, such as a traumatic experience. So for example, if parents get separated, and separation is one of these ACE factors, parents who can put aside their differences, place the priority on that child's needs at the time, sit down and talk with the child together about that divorce, what we know is that child will do better in the long run because their needs were put first. The second really important resiliency factor is social support, and this can happen at any stage of development. So it can be the social support you receive as a child or the social support you receive as an adult to help you overcome those childhood experiences. So what we want to do is try to identify more, have a greater understanding of what other things make individuals resilient in the face of adversity. We're not there yet, but we're getting there, and we're trying to study large population studies in Alberta in order to really be able to figure out how we can best help and service families.
So we have some time for questions. I have a question, though, and I probably should address it to everybody, including Paul. So this sort of understanding has been a long time coming, the link between childhood moving into adulthood and so on. Does anybody know what the barriers to, as Sheldon said, putting the dots together has been in the past?
I think from an academic perspective, it's requiring people to become so specialized in their fields and not encouraging collaboration across disciplines and multidisciplinary approaches. I know that in the last few years since I've undertaken this research, I've received criticism from some in legal scholarship about, but you're not a brain scientist. Why are you talking to brain scientists? And it's like, well, I don't have to be a brain scientist. Part of what needs to happen in order for me to be an effective lawyer is for me to challenge Paul to explain things to me in a way that I then can explain it to a jury or to a court or to the public, or the legislators, depending on where I'm doing my advocacy. So, for example, Paul has tried to explain to me genotypes and phenotypes, and I'm like, but I don't understand, and I don't understand, and we talk, and then he says to me one day, let me put it this way. Some people are dandelions, and some people are orchids. And the dandelions are going to do fine wherever they're planted. But the orchids, we need to get the sun just right and the water just right. And if we do, they're going to be exquisite flowers one day. That works in the courtroom. That works with the legislature in a way that doesn't happen when you talk about serotonin transporter. What's the D for? So part of it is allowing experts to go outside their areas of expertise and try and learn from each other, and learning how to translate to one another so that we can translate to the people whose ears we have.
Well, and I think just to add on that, I mean, I look at the city. I mean, we think outside the box, and we're always striving to be better. And I think this is no different, right? We looked at the issues as they presented themselves. We looked at, and we said, well, yeah, we need to be doing this together. So let's just do it. We basically didn't ask for permission. We just went and did it. And now we have 7 sites that are identified in Alberta. We're Red Deer, who's here tonight, we're building Child Advocacy Centre there. We'll be building Child Advocacy Centre in Medicine Hat or Lethbridge. We're not sure which city yet, but Lloydminster, Grand Prairie, Edmonton, and Fort Mac. And basically, we're trying to have a provincial model of practice.
Paul, did you have a comment?
Yeah, just maybe another potential barrier in line with what you're asking is I think a lot of the information that the initial research was looking backwards, so looking at large populations of adults and getting their histories as children. And I think one of the things that, all of us on the panel, we're working with populations of children and youth, and the focus of the Mathison Centre, I think, is so important because we're looking forward. So we're starting to, take the research, look at kids, and follow them over time. And there's all sorts of questions that we can only answer doing that. But
on that similar topic, how do you connect the public with the integrated recovery?
I think if we look at a community, like I just had a coffee today with Katrina LeMaydon, Calgary Sport Council. Well, we know that sport is absolutely critical for mental health and physical health. And why aren't we making that connection even stronger, right? And I think when we look at community, our message out to community has to be a very collective, clear message. I think if we look at, well, I'll give you an example. If we look at what we just launched with Calgary Catholic and CBE, we actually created a video that's signed off by Alberta Health, Child and Family Services, the RCMP, and Calgary Police on how to recognize and how to identify these cases. Like, believe it or not, right? Everybody signed off on one message, right? But before, it was a message from health, poster from Child and Family, but everybody was saying something different. And I think that it's our job to bring clarity so that we can bring a simplistic, simple, 101 message to the community that connects the dots and paints the picture.